Now, you might know we've been following the course of this disease, looking at the data points over the course of the last few months, and I was desperately hoping there was going to be some good news to bring you right now about the figures for the UK, but I'm afraid we're not quite there yet. It's mostly, I'm afraid, yet more depressing news. But there is one piece of good news, which is that we are getting there. When it comes to excess deaths, which is the key metric we've been looking at over the course of the last few weeks, giving you a sense of just how the UK is coping, how this is going in terms of public health, how it's going in terms of all of our lives, our families. Excess deaths is that key measure because it gives you a sense of looking at the average number of people who have died in recent years. So you can see this is the average who've died starting in January and then going through to where we are at the moment in previous years. And you can see it kind of peaked in January and kind of flu season. But let's add on the line for 2020. There you can see pretty vividly what happened with COVID-19. So the crisis increased the number of people dying across the UK. And I should say this is death from all causes, but I'll show you COVID-19 in a moment. And we were really hoping, you know, all of us, hope against hope, that by now that black line there would have got down to meet the blue line. So basically, you'd have had a moment where we weren't having any excess deaths. In many other countries, they are down at that moment right now. But I'm afraid we do still have 1,800 people dying more than on average do around this time of year. That's in the last week of May, towards the end of May. And the depressing thing really is when you add up the number of people who have died above the average over the course of this period, so basically the gap between the black line and the blue line there, you're talking about 64,000 now. So that's confirmed deaths above the average that we've had so far, of which 50,000 have been put down to COVID-19. Now, those are deaths where they have COVID-19 on the death certificate. But, of course, that still leaves an extra 14,000 which are just unaccounted for at the moment. Now, the ONS, the Office for National Statistics, thinks that might be COVID-19 that was just undiagnosed. It might be other causes like the lockdown. And a lot of that is happening in care homes at the moment. It's just difficult to get those deaths certified in the way that they would normally be. And that's really kind of borne out by what we see here, which is looking at different deaths in different settings. And what you can see, the line here, the kind of bottom of this, is just zero excess deaths. So that's the normal, the average number of people who die in these different settings each year. And this is the number of people who've died at home, so in domestic settings, actually, again, above the average. And we've talked a lot about care homes. We haven't talked as much about deaths in domestic settings, but they're a lot higher than they normally are at the moment. And fewer of them are actually explained by COVID-19 right now. Then you've got deaths in hospitals, so peaking early, but then coming down quite sharply. And you can see over there are fewer people dying in hospitals now, or at least in the latest week, than usually do. So fewer people dying in hospitals right now than usually do. Negative excess deaths, if you want to put it like that. And then you have care homes. Now, this, of course, of many, many tragedies in this epidemic is perhaps the greatest. You can see how the disease peaks and then is transferred from hospitals to care homes, and you have the greatest number of deaths in care homes, excess deaths in care homes. And also, we're not there yet. Again, you've got more people dying in care homes and at home than normally do around this time of year. So it is certainly coming down, but it's not there quite yet. And there has been lots of talk over the course of the last week or so about how the UK has... Well, I saw one story about her saying how the UK had more deaths than all of Europe combined. Well, you know, there's lots of depressing stuff here, but I wouldn't get too depressed by that because there's a reason that we're getting some statistics that make the UK look particularly bad, and it's because of the nature of this line. Now, this is just COVID-19 deaths, the official count we get each day from the government, and you'll probably notice when you look at it, it's a very jagged line indeed. What's happening here is you're seeing lots of weekends here, so numbers kind of go down after the weekend, then they bounce back, and you're seeing the government also trying to fill in the picture from previous weeks. So we didn't have a very good picture of how many people were dying initially, and they're starting to fill that in. The real picture that we know now looks more like this. So this is, by the way, I should say, it's England and Wales. It's just the most comparable numbers I've been able to find. But this is really what happened. This is what we now know when people died from COVID-19 over this period. And you see the line is a lot smoother, and also it was higher earlier. So more people dying early on in the pandemic than was reported by the government at the time. But right now, here's the key thing. That line, the white line, tends to be a bit lower than the line we're getting a lot of the days from the government. So you might see some scary numbers from the government about, 300-400 people perhaps dying. In reality, what's happening is they're filling in the gaps and trying to allocate some of those deaths that they've only just kind of found out about, only been registered, onto recent days. The UK doesn't have more deaths happening each day than all of Europe combined, but it certainly does have one of the worst records for this disease of any country around the world. The best way of measuring that is actually not looking at this, but it's looking at excess deaths, comparing it to the size of the population. And here's the picture you're left with. These numbers, some of them are from the FT. I've updated the UK with the latest data that we've just had through. But what you can see here is, in terms of, compared with the size of the population, number of excess deaths in the UK is more than Spain, Italy, Belgium, Netherlands, France, US and Germany. Now, these figures are getting updated all the time, so this is not definitive. This is not the last word on this, but it does just show you that the UK has one of the worst crises in the world, if not the worst. And, well, there it is. It's a testament to what we are going through right now. And if you kind of break up the different parts of the UK, what you see is an interesting pattern. So England there at the top, so the worst outbreak in the developed world in England. Scotland, though, also very high indeed as well. And that's perhaps slightly underappreciated, how many excess deaths there have been in Scotland as a percentage of the population. Then you've got Wales a bit further down, and then Northern Ireland really, in a way, is the outlier, with the least bad outbreak of any part of the UK. But it's worth saying, still worse than France, or indeed the US or Germany as per head of the population. Now, when we're looking at these numbers, it's also worth just kind of looking at a different way of measuring the number of people who are dying of COVID-19, and that's looking at trajectories. So not looking at the total cumulative number of people who have died, but looking at kind of where we are heading. And this line shows you how many people have died each day. It's a 7-day average, though, in the UK. And so it's a similar picture, up very sharply initially in the crisis and then gradually coming down. I should say it's a logarithmic chart, so it kind of gives you a representation of growth here. But if we compare that to other countries, well, have a look at this. I've picked out a couple in particular here. You can see Brazil there, and you can see Sweden. And actually, the UK now, if you just look at the rate at which people are dying each day, the UK actually is below Brazil and below Sweden at the moment. And in a way, this underlines what we're seeing right now with COVID-19. Many countries around the world are seeing their numbers starting to fall at the moment, many in the developed world, whereas it's other countries like Brazil, to some extent India as well, who are seeing deaths increase quite sharply right now. I'll add on the US and Italy and France, so you can see that. So in many countries in the West, it's coming down. In other countries in the emerging and developing world, it is starting to go up. That's where the disease is most rife, most intense at the moment. In the UK, though, as I say, it is getting better. I know a lot of these numbers are very depressing. I know, certainly looking back at those totals, it is deeply depressing. But we don't yet have any evidence there is a second wave. A lot of people are talking about the risk of a second wave. We're not there yet. Have a look at this. This is the key number we're going to be looking at. This is not deaths, but cases. So the number of new cases in the UK. Now, initially, testing was appalling. So this didn't give us a very good metric of what was going on. But we're going to keep a close eye on this, and particularly where it is right now. So the number of new cases now in the UK, down to the lowest level it's been since early on in this pandemic, not going up. There isn't yet a sign of a second wave. So that is something to be moderately reassured by. And we're going to keep a close eye on that over the course of the next few weeks and months to, get a sense of whether we are indeed heading for another outbreak. But for the time being, yes, there is lots of depressing news, but happily, a little bit of slightly more reassuring news too.